I'm Dr. Ira Almeida, Director Health, and I'm happy to share with you this moment when we have completed 100% vaccination of our second dose. We have been working very hard, the whole health department and Directorate of Health Services, to reach this point, and today we are 100.058% for second dose. As you see, I mean, you can't really make out, but if you take the curve, we are at the end of this curve, this wave, and we are where we were in December in 2021. And we think that all this is thanks to our vaccination, our good vaccination program. I'm sure you'll have one question as to if we are 100% vaccinated, why are we still getting deaths? This is because no vaccine is 100% effective. You have some vaccines which will not work in people who are immunocompromised. Like today we have had 5 deaths, of which 2 are, one is a case of cancer with metastasis in the lungs. So he took 2 doses, but yet he succumbed. Or if you have comorbidities, sometimes the vaccine does not work as well. So whatever chance there is, people with comorbidities should get vaccinated. And we do have a few people who are still not vaccinated, especially these elderly and people with comorbidities, and who don't want to get vaccinated. So we urge them to come forward and take the vaccine. We have also achieved 100% because there are few numbers here of people who visit the state during these tourist months, and we have people coming into the state, people going out, and of the number that has been given to us by the ministry, we have now completed 100% vaccination. Dr. Borkar will give you more details of our vaccination program.
Yeah, I'm Dr. Rajendra Borkar, and I'm functioning as immunization officer for the state for Directorate of Health Services. As Madam has said, we are extremely happy to share with you all that we have successfully completed 100% immunization of all the people in Goa. We had a target of 11,66,000 as our population, and today, as of today, we have covered the percentage of 100.058. I would say it is just touching 100%, but that is definitely a happy moment, because we are amongst very few of the states all over India who have done this in this much of time period. And as Madam has once again said, though we had so many gatherings, so many functions and this and that, still our hospital admission rates, our deaths are very less compared to what it was in the second wave. We had lots of infections all this while, but our hospital admissions, our complications and deaths are much less compared to number of patients that we had. We contributed to the successful immunization drive that we had, and I must thank all our health staff, especially in the periphery. We have completed 1 year and 1 month today. We started it in 16 Jan 2020. 16 Jan 2021, and today we are in Feb. So we have completed 1 year and 1 month, and within this period we have successfully done this. It wasn't an easy task anyway. We had cyclones in between, we had heavy rainfalls in between, but I'm happy to share that in spite of all the hurdles, we kept going. Our health centers were open for all the people all the time to get vaccinated. We from DHS side had some novel ideas like vaccinating from 8 to 8 p.m., meaning 8 a.m. to 8 p.m. We also have vaccination on all the holidays, Sundays. If not at all the places, some strategic places, we always kept some provision to get people vaccinated. So all in all, extremely happy to inform that Goa today has completed 100% vaccination of all the people in Goa. But as Madam has said, let me tell it from my side also, people will still come for first dose, people will still come for second dose. That is only because when we claim we have 100%, it is a number. But some people from other states must have come, some people from our states must have gone out. So that is why, at least for a while, the number will keep coming. But let me happily tell you that number of people coming for first dose have reduced significantly now. At one point of time when we were saying that we have vaccinated 100% for first dose, still many people, as much as say 500 to 700 people would always come for the first dose. That number has remarkably reduced now. But still some number for first dose, some number for second dose. We are not worried. In fact, we are happy that they are coming and getting themselves vaccinated. The last part is that school going children also, we have been successful in vaccinating them to a tune of 87.51% and second dose to 65%. Now the only thing is that we are 65% in the second dose because many of the children have got positive with COVID infection during this third wave, and therefore they have to wait for 90 days. All in all, people have cooperated extremely well. I thank each and everyone from Goa for getting themselves vaccinated. I also thank all my peripheral staff, my colleagues, especially my director, because she has been proactive and was after us to get it completed as early as possible. And last but not the least, the media, who has always been supportive to our program. At one call you have been with us, always given the positive messages, and that is the reason why we could counteract negative messages which tried to crop up in between. So all in all, a good day for us at DHS, and very happy moment for all the people in Goa also. Madam, I would like to...
Just one more point is, we will now integrate the vaccination, COVID vaccination program into our normal routine immunization program. However, the swabbing and testing will continue on all days. So COVID vaccination centers will now close, but the vaccination is available through our routine immunization sessions.
Yeah, the thing I want to just clarify why we have made this change. These vaccines which we have, they are either of 10 dose vial or 20 dose vial, and if we keep it going all 40 centers, there is lot of wastage of the vaccine. So also our manpower gets deployed there. We have so many other things to take care of. So now from tomorrow onwards, on each peripheral health center spread across the length and breadth of Goa, we still have vaccination, but only on the routine immunization days. Usually it happens to be Thursday, it could be Monday or Tuesday in some other days, but at every week, at least once we have the opportunity for those who have not been vaccinated till today. So the vaccine supply is ensured, delivery is ensured, people don't have to worry that the centers have been closed. They will always be getting vaccination. I only request people, if possible, they can go in groups so that the vaccine is not wasted. Thank you.
Okay.
Ma'am, you said you all have completed 100% vaccination.
Yes.
Second dose. But you has staff on the front here. They state that people who died due to COVID from that, like out of 10, 6 have not taken any dose of it. So how is that possible? If they have not taken the vaccination, then how is it how you can say that it is 100%?
So that's exactly what I have said, is that although there will always be a few people who have not been vaccinated, and these are the people the virus is searching for, and the virus is setting up shop and causing an infection, and ultimately some of them are succumbing. But we are able to do this is because there's a lot of inflow of outside people coming in, and we have our people going out, so it is kind of equalizing. But there will be a small population who have not taken the vaccine. If you take today's statistics, 2 have taken the vaccine, 2 doses, 1 has taken 1 dose, and 2 have not taken the vaccine of the 5. So one thing is they have not taken. The ones who have taken, it has not worked in them because they have certain conditions, underlying conditions. So that's the reason why these small numbers are the people who are getting infected. And it is heartening for us that we know that the vaccine has worked, because so many others have gone home without succumbing, and so many others have not got the infection.
So I must say that we shall not consider that vaccination is 100% completed in Goa.
It is. Just
See,
Dr. Burkar also explained to you about the numbers.
I'm telling you that we had a target of 11,66,000 given by the ministry. This is a number that we are expected to vaccinate. These are our population which is targeted above 18 years. Now, some of them may not have taken the vaccine. Some people from outside may have taken the vaccine. some of our people may have from Goa gone outside. So we cannot say for sure that all the Goans are vaccinated, but as per the target, number-wise, we have completed 100%. Now what percentage may have remained, 0.5 may have remained. And these are the people, as Madam is saying time and again, these are the people who are succumbing if they are aged, if they have some comorbidities, if they have some other problems, and there may be a few people who are vaccinated with all the doses, but their body has not taken up the vaccine for some known reasons, for some unknown reasons also. Vaccine is not 100% sure shot. But considering the risk and the benefit, we say that people who take vaccine are saved of complications, death, and admissions. So we are sailing safe. Yeah, thank you.
Is it effective? Vaccination is effective.
Madam, this is what the fact is showing us. Madam has shown that we are touching the bottom of the curve. This is in spite of all the gatherings that we had, and therefore it is beyond doubts that vaccine is effective. If the vaccine was not effective, many more things could have happened.
But how people are getting corona? How vaccinated people are getting corona? See, we know that this second, the Omicron one, the vaccine does not protect you from getting the infection, but it definitely protects you from getting severe disease. And that is why in the third wave, although so many people got the infection despite being vaccinated, the numbers who have died are very, very low. You know last time what happened. There were no beds, there was no oxygen, we couldn't meet the demand. Definitely the health services and the Goa Medical College has geared up to meet that, but you know that the numbers were so low. In fact, we are contemplating closing down the COVID hospitals in the periphery because the numbers have come down so low.
So close but not closed, no?
Not yet closed, no.
And Dr. Bosa can share the number of the deaths in the third wave and those who are vaccinated and those who are not vaccinated.
I can give you the numbers maybe tomorrow because I haven't come prepared for that. We only wanted to tell people of Goa that we have completed 100%. But let me, last time we had given you the total details. Now we'll have to only add from that conference of ours and from today. It is not that. Yeah, yes. Definitely. We have
it separately for second wave. We have separately.
Ma'am, I hope you got the point clear. If I have 10 vaccines also, still I can get infected. Infection meaning the virus has entered our body. That is infection. That we cannot stop. But what virus can do to us after entering is because of the vaccine. And amongst that also, if we give vaccine to 100 people, not all 100 people will be very powerful to fight the vaccine. Some people, because of the problem in their own system, may not be able to be effective as the other people are. So some people will definitely suffer, but they are negligible people.
Is it mask is required now since it is 100% vaccinated?
Yes, mask is required. Till the time the government of India doesn't declare that all over, because we are talking about Goans. Many other people are coming, we don't know their vaccination status. So till such time that all over India, the pandemic is under control, we will not be able to say that mask is not to be used. A time will come when we will be declaring, the government of India will declare from pandemic to epidemic, and then, or endemic. That is the time when we will be taking a decision about whether we should throw away the masks or not.
Dr. Aya, can you just update us about the variants which were more dominant in the third wave?
See, we have not done any genomic sequencing here. In fact, yes.
How many reports received and
No, even that stat I'll have to give you. Only some 21 cases we had. So that breakup I will give you. Okay?
tomorrow?
Yes, definitely. Yeah. Most of it was a mix of Delta and Omicron.
Yeah, so thank you.
Yeah.
Thank you so very much.